treatment always the involvement of the families?
Absolutely. You cannot treat a child and adolescent without the family, because you're only, and in fact, many times, the child is the most vulnerable member, or the adolescents. And so they will have a symptom when really, not infrequently, it's a symptom of family dysfunction. And so if we were to ignore the family, we also might be missing where the real problem is.
Because when you talk about resilience and preventive care, when it reaches the level that you are called upon or that you see them in their office, that's where treatment come in. And it might involve medications too.
That's right, that's right. And certainly our approach is to use medications only when it's needed, but also to work with the family and the individual to see what their preference, because there are times when it's elective, and we'll outline that to a person and say, well, we don't really need to use medication, but it certainly could be of help. We'd like to really try and emphasize the other measures first, because I think that's something that medication has been overemphasized, even though we prescribe a lot of medication because it's helpful. We see a lot of people who need it.
It's such a quick fix in many people's minds.
Well, there's nothing wrong with a quick fix if it actually is a fix. But when it's an illusion of a fix, that's when we're really not in favor of it.
Let's talk a little bit about bipolar, only because, again, that diagnosis is so crippling and sometimes so permanent, but its onset is so unexpected, late adolescence.
And I think
are there earlier signs?
Absolutely.
Okay.
Absolutely. And actually, I wrote an article on it that's on the website called When ADHD because is Not ADHD, about bipolar disorder, when it was first looking at the differences between the two disorders. But the onset can be very early, it can be in infancy. We wouldn't make an actual diagnosis at that age, but you can see the manifestations. And it often runs in families.
What are manifestations?
Well, it has to do with self-regulation. That is, the baby may be crying for no reason, and you can't really establish what it is, impossible to soothe, kind of always on the go, and really very anxious. In childhood bipolar disorder, often the first manifestation is anxiety. Then we have the onset of attentional symptoms.
Well, anxiety would be awfully hard to sort of understand. So again, this importance of a wonderful relationship with a pediatrician would be so helpful to parents.
That's absolutely true. And then looking at the family history. If you have a family history of mood disorders, you're going to be thinking about it more.
And that's, again, something that 30 years ago, that would never have been part of our ordinary conversation, and certainly is more so today. Are we on the East Coast or in this sort of mid-Atlantic region more aware, or, you know, does somebody in the heartland go through these same processes?
Yes.
Is there situational, I guess, you know, this pace, this stress in our area?
Well, the pace and stress, and in particular, the fact that we live in an area where it's very transient. There are many people people in the military, people in the State Department, people in government, people in corporations who are being uprooted. And when you uproot people and break their relationships, that's tremendous stress, particularly on children. And so, yes, they are more vulnerable.
Let's talk a little bit about self-injury and about eating disorders. So much of this behavior, an adolescent will try to keep hidden from parents. That's
Absolutely.
One of the complicating factors.
Right. So one of the things with self-injury, there's a little warning sign is when it's rather warm, but there's long sleeves.
Long sleeves.
Long pants.
And an eating disorder might be initially signaled by a weight loss or an overemphasis in terms of eating and weight.
Exactly. And again, the person may hide their body so it's not seen how much weight they've lost. They really go to great lengths to hide this from parents.
And one of the issues is when this starts to manifest itself and then going to college, where sometimes parents will lose that day-to-day contact with a child, and this might exacerbate the behavior even more.
Exactly. And so we try to prepare both the family and the adolescent going to college to be more independent.
Now, you also practice at Dominion Hospital,
Absolutely.
which is a hospital that has beds that are occupied by kids who need to get into an environment that's a 24/7 environment.
Yes, but we also have day programs so that we have the child actually in the hospital 24/7, only for as long as needed for reasons of safety.
Stabilization? Or?
And then we'll shift them into the day program. And that's been a really big advance in the last, I'd say, 10 to 15 years, is that we've really tremendously shortened the inpatient part of the stay by having a day program available.
When you first decided that psychiatry was going to be your area of specialization, did you, were you able to see what it might look like in today? I mean, today's practice must be different than somebody.
Very, very different. Very different, yes, because we have so much more that we can do than we used to be able to. It's really like a miracle. Our understanding has improved, our ability. Unfortunately, people a lot of times still are not diagnosed and referred for treatment or really have treatment available to them.
Do you find that there's just so much resistance on the part of a parent to seek help? Is that, is there not enough information in the general culture?
I think, yeah, the general culture. I wouldn't say that overwhelmingly it's the question of the parent not willing to seek help, because it's a question of understanding.
Knowing what you're seeing.
Exactly, right. And understanding. If treatment is there's much less stigma than there used to be. I think one kind of funny story is I was talking with a 14-year-old girl about a particular medication the other day, and she told me, well, she didn't really want that medication because she had several friends on it, and she already knew the side effects of that. And 20 years ago, that never would have happened. People were not talking amongst themselves about what medication they were on or what illness they had.
And a lot of this is just information that's available to anybody on the internet, but another good part is that there's also help available in terms of direction or walking through some symptoms.
Yes, absolutely. There's a lot of help available.
If you could paint a magic picture of the best society possible, what would that look like?
Well, I wouldn't have a job.
And that would be a good society.
Right, because exactly.
That's bittersweet. So let's talk about your website again, or if you want to. I know the screen is showing it.
Exactly. PediaPsych, www.pediapsych.com. We have a lot of information, and we're really also interested in promoting advocacy. So if there are events that people have that they would like to be known, they can email that to us, just send it to us. You can do it on the website. And we will put it up onto our advocacy section because we do think that it really isn't understood enough by the society in general what the true development needs of children and adolescents are. And we think that'll do a lot to really prevent illness and really to promote development.
And here we are in public policy again, because that is an end result of a lot of this advocacy. Thanks so much, Dr. Gary Spivack, for talking with us today about issues that are difficult and painful, but we need to open or turn on that light about them.
Thank you so much.
Okay, and thank you for staying with us. This is a subject matter that isn't easily discussed. All of us who are parents know the pain and joy of child rearing, and part of that joy is being able to help our kids. So this is Health Focus, brought to you by HCA, the Hospital Corporation of America, with facilities here in Virginia at Reston Hospital, Fairfax, and Reston Surgery Center, and 3 new projects coming online. So again, thank you, and we'll see you next month on Health Focus.